Hello, my name is Pirina Pin, and I'm going to talk about gastrointestinal complication of granulomatosis with polyangitis. Definition: Granulomatosis with polyangitis is a small and medium-invasive vasculitis with a predilection for respiratory tract and kidneys. It causes preliminary necrosis of small and medium-sized vessels, leading to organ dysfunction. Gastrointestinal involvement is seen only in 5 and 10% of the cases in a poor prognostic factor.
Hi, my name is Dr. Les Mertz, and I'm a rheumatologist at the Mayo Clinic in Arizona. I would like to tell you about an autoimmune disorder called ANCA-positive vasculitis and a new study that the Mayo Clinic is participating in at this time. Most of you already know something about the immune system. When the immune system functions normally, it helps to fight off viruses, bacteria, and cancer cells. When the immune system functions abnormally, you may develop unusual infections, or damage to the normal cells and tissues of your body. Autoimmune disorders develop in such circumstances, and you already likely know about some of them, including rheumatoid arthritis, systemic lupus erythematosus, dermatomyositis, scleroderma, and vasculitis. One of the most common types of vasculitis is ANCA-positive vasculitis. ANCA stands for anti-neutrophil cytoplasmic antibody and represents the antibody that can be found in your blood when you have one of these conditions. There are actually 3 of these, including granulomatosis with polyangiitis, previously called Wegener's granulomatosis, microscopic polyangiitis, and eosinophilic granulomatosis and polyangiitis, previously called Churg-Strauss granulomatosis. If you have granulomatosis with polyangiitis or microscopic polyangiitis, your doctor will likely prescribe medications that suppress the immune system to reduce the inflammatory damage that may occur to your tissues and organs. These medications may suppress the immune system enough that you will actually develop an infection or be at increased.
Applications in medicine. The disease proved fatal despite aggressive management. Poor prognosis with intestinal perforation is well known. Intestinal perforation in GPA is a rare manifestation of the disease. Until date, at least 11 cases have been reported in the literature. The main age of the patients having ANCA-related perforation was 48 years. The most common sites of perforation were the ilium, stomach, and esophagus. The small bowel was involved in all cases with either involvement, in 82%. Ulceration and perforation are the most common pathologies.
It was Memorial Day weekend. I remember it like yesterday. I got a call. He's gasping for air, and the Vanderbilt Air Ambulance Service medevaced him from Tennessee here to Teterboro, right here to our hospital where we fixed him.
One of our local ENT doctors who I knew was nice enough to actually go up with me in case I didn't quite make it up there.
Most doctors in a crisis situation like that Glenn found himself would perform a tracheotomy, which is not wrong, by the way. You establish the airway, you secure the airway. That's a very basic principle, but many people just don't want to have a hole in their neck, and I think that's legitimate, and that's one of our value added here, is that we can manage these cases without cutting a hole in your neck.
It was very intimidating to come to New York City to go so far for medical treatment, and to have surgery in a hospital 1,000 miles from home is scary. Dr. Lebovics made me feel comfortable right away, and I knew that I was in good hands, despite all the people and buildings, and you guys talk funny.
Let me try to explain to you with a model of what I did with Dr. Hatcher. You can see from here, we take these special microlaryngeal scissors and we make cuts right into that scar band, right to where this cartilage is, and I can actually feel it as I'm cutting. And under direct vision, I will then inflate the balloon in the area of the stenosis after the cuts were made and after the steroids have been injected. Unfortunately, with Dr. Hatcher, he had disease in both the subglottic larynx and proximal beginning of his trachea, both the first and second tracheal rings. So when Dr. Hatcher was asleep, paralyzed, we pre-oxygenate his lungs. Something called the functional residual capacity, or the FRC, acts as a reservoir or capacitor to provide oxygen to him.
As soon as I wake up from the anesthesia, I immediately notice that I can breathe much better.
The great thing is a patient like this, such as Dr. Hatcher, he gets to the recovery room and like say, oh my God, I can breathe. And they're smiling, they're happy. I've had patients cry from happiness in the recovery room saying, oh my God, you don't know what you did for me.
It's hard to express how grateful you are to someone that allows you to live and live normally, and realizing that there's maybe no one else out there that can do it to this degree. No one else has reproduced his success.
Ultimately, this is all about one thing, doing the best by people and treating them the way you'd want to be treated if you were a patient.
As a physician myself, I know that it's hard enough just to keep up with what's going on. Dr. Lebovics is one of the few.
In the recent times, more than 80% of patients who are treated are alive at least for 8 to 9 years. In treatment, they have a higher long-term survival rate and have been able to live normal life. Cons. Living with granulomatosis with polyangitis can be very challenging, fatigue, pain, complications of disease. Some complications require surgical intervention. The disease has a predilection to upper and lower respiratory tract and the kidneys, but most patients also show systematic disease. Issue apply in Ecuador. The diagnosis of the disease is based on the presence of clinical manifestation, the determination of anti-neutrophil cytoplasmatic antibodies, and the performance of anatomopathological studies that confirm the diagnostic suspicions. Other tests may be indicate to determine the presence of complications or the essence of the disease.
My laboratory is focused on the biology of neutrophils in inflammatory disease. Neutrophils are key players in autoimmune vasculitis, characterized by the presence of autoantibody called ANCA, directed against neutrophil proteins. One particular form of vasculitis our lab is interested in is granulomatosis with polyangitis, GPA, which is a severe disease involving vascular inflammation, blood cell necrosis, and the formation of granuloma in various organs like lung and kidney. Also, the main target antigen in GPA has been identified as proteinase 3, a serine protease located within azurophil granule of neutrophils. We do not know exactly how proteinase 3 contributes to the inflammatory process and the immune dysregulation in this disease. And that is the question we address in the present study. A hallmark of this disease is a failure in the resolution of inflammation, and one crucial step in this process is the phagocytosis of apoptotic neutrophil by macrophages, which allows the return to homeostasis. Phagocytosis of an apoptotic cell, here in red, will reprogram the macrophage towards an anti-inflammatory phenotype, which will create a microenvironment which will favor
Conclusion: the importance of this case lies in the typical presentation of mycobacterial infection in a mycopathogenic patient, but resident in an endemic area. These infections must be recognized by primary care physicians, especially in populations such as Ecuador with high rates